In one part of the world, a race to vaccinate. In another, the long wait. Richer countries have plenty of funding and plentiful vaccine doses. Poorer countries have neither. It could be years before some are fully vaccinated. Recent setbacks with the most accessible vaccines, AstraZeneca and Johnson&Johnson, aren't helping. Global vaccination at 2 speeds. What does it mean for lives and livelihoods? And can anything be done to prevent it?
Well, India is now the world's second worst affected country. It surpassed Brazil, putting it only behind the United States. The increase in infections could affect the world's vaccine supply. India is the biggest producer. Many parts are running short of supplies as inoculations expand due to the surging cases. This comes as hundreds of thousands of Hindu pilgrims gathered at the Ganges for a ritual bath as part of the Kumbh Mela festival. While authorities made efforts to offer coronavirus testing, most participants haven't been wearing masks or distancing themselves. Festivals and rallies are being blamed for the spread of the virus in India. Denmark has completely dropped using the AstraZeneca vaccine, and more countries are delaying the introduction of the Johnson&Johnson single shot after US authorities recommended a suspension. The European Union and South Africa said they won't be administering the jab for now. There have been reports of rare blood clots. Similar concerns with the AstraZeneca vaccine prompted countries, including Germany, to restrict its use. The delay comes as a blow for developing countries. They'd been counting on the 2 vaccines. And that's raising questions about when widespread vaccination coverage will be achieved. By the end of the year in high-income countries, middle-income nations will have to wait another year, and poorer places not before 2023, if at all. A key factor holding back the vaccination drive is patents. Nick Dearden is Director of Global Justice, part of an international movement to challenge the powerful. Nick, how different would things be if these pharma firms didn't have patents on their vaccines?
Well, we would be able to ramp up production much more easily than we currently can. I mean, at the moment, we have an artificially constrained supply precisely because all the manufacturers in the world who want to produce this vaccine can't unless it is specifically licensed by the company that owns the patents. And when you bear in mind that an awful lot of these products were made with public money, huge amounts of money coming from governments like the US government, European governments and international institutions, it's just really scandalous that we've privatized this knowledge through patents to a handful of big corporations who are now deciding who in the world gets this vaccine and who doesn't. I mean, across Africa, where we're seeing the most awful wave of coronavirus spreading, even frontline health workers haven't been vaccinated. Meanwhile, in rich countries like my own, people who are far less at risk of this disease are getting vaccinated ahead of those who need it more.
I thought I was living in a great place, Germany, but I'm still waiting for my shot. We have a vaccine, which is fantastic, but I keep hearing there are production problems. But then, as you say, we're not even using all the production capacity out there because the patents prevent that. Is that right?
That's exactly right. So some of the biggest vaccine producers in the world are not producing coronavirus vaccines simply because when they tried to create their own vaccine, it didn't work and they don't have one. And they can't and they haven't therefore geared up their production facilities, their factories and their manufacturing capacity to produce the vaccines that we've got. So it's absolutely great that we've got these vaccines. Like you say, an awful lot of public capacity and public money has gone into creating these vaccines. But it's, we have factories across the world who could produce hundreds of millions more vaccines, including in Europe, who are saying, we want to produce this vaccine, give us the technical know-how. And big pharma companies are saying, no, we're going to keep this to ourselves. And unfortunately, rich countries like our own are standing behind them and allowing them to do that.
Exactly. I'd like to point that out and give our viewers a couple of examples. Moderna's vaccine has been nearly entirely funded by US taxpayers, but it's being sold at basically a fully commercial price. On the other hand, we have others like AstraZeneca who are saying, OK, we're going to sell it for much less, but they still have the patent rights over supply, which means people like me still haven't been vaccinated. I mean, don't politicians get it? They're allowing these companies basically to run amok, aren't they?
They are. They absolutely are. And you're absolutely right about AstraZeneca. I mean, look, these companies aren't all the same. Of course, we think it's great that AstraZeneca have said they won't be profiting during the pandemic, although I should point out that they can decide when the pandemic is over, and at that point they will begin profiting. And look, with a company like AstraZeneca, there was some research done just a couple of weeks ago, which found that the amount of public money that had gone into research and development, public and charitable money of the Oxford AstraZeneca vaccine, was about 97 to 99%. In other words, the company has put virtually no money into research and development. They've then been given at least $2 billion to ramp up their manufacturing and do trials and so on. This company hasn't created this vaccine. A university created the vaccine. They've then been helped to scale up manufacturing. Sure, pay them for the work they've done, but don't, for goodness sake, allow them to keep a patent for 20 years and decide who gets it and who doesn't get it. And when you do that, you've seen yourself. I mean, even here in the rich world, the argument now between the British government and the European Union over the contract signed with AstraZeneca, this is just nonsense. It's a public health emergency. We need international cooperation, not a very, very small group of people deciding who gets this in what order.
Well, Nick, politicians in South Africa and India have proposed a temporary suspension of coronavirus patents. The WTO likes the idea. There are signs the US does too. Why isn't that gaining more traction?
Well, this is really interesting and it is exciting. Look, we didn't expect this to happen quickly. So, it's going to take a while to put this pressure on, but the pressure is building. We've now got Hollywood stars and celebrities. We've got former world leaders calling for this to happen. And I mean, absolutely amazing that apparently the Biden administration is considering this proposal from South Africa and India to waive patents. That would be an absolute game changer if it happened. To date, almost all rich countries have sided with the pharmaceutical industry, presumably believing it helps their country's economy in some way. If the pharmaceutical industry makes a lot of money in the country it's based in, we completely dispute that, and we hope, as a result of the problems we're seeing around the world now, politicians are going to begin changing their minds on this. After all, it's really not acceptable that governments like my own can tell South Africa and India, where there are huge problems getting vaccines into their own populations, there's no problem. Don't worry about it. The market will solve everything in the long run. It's not acceptable. And we hope that case is now being heard loud and clear around the world. Most countries of the global south are demanding a different way of doing this. And by the way, that different way of doing it isn't just going to help us get out of coronavirus, which is really important and, of course, at the foremost of our minds now, but it's going to get out of the situation we've got at the moment where most countries in the world are dependent on their medicine supplies coming from a small handful of countries. That's no way to run global research and development in medicines. It's no way to produce medicines in a fair way internationally. And we need to start a different means of collaborating on medical research, of factories being based all around the world so that people can have a lot more security on where their vaccines are coming from. And that's going to be a big issue for coronavirus because this is unlikely to go away anytime soon. We've seen that now. But for all manner of other diseases, we need to have a far more distributed manufacturing system around the world. And I hope that this could be the moment, this could be the wake-up call where we begin to develop that.
Nick Dearden, Director of Global Justice, thanks for being on the show again.
That's a pleasure.
But what about people who don't want the vaccine? Here's Derek Williams.
How does the refusal to be vaccinated correlate with an increase in mutated virus?
This question is one that anyone refusing a vaccine needs to think about long and hard. To try to answer it, let's first go over some basics that everyone should be able to agree on. Number one, like all viruses, SARS-CoV-2 regularly mutates, producing new versions of itself that we call variants. That's not up for debate. Number two, more of those variants will, of course, appear when more people are infected. Three, the chance that random mutations could alter the coronavirus for the worse, like making it, for instance, more contagious or more deadly, that chance rises along with the number of people the virus infects. So four, logically, to limit the chances of even more possibly dangerous mutations arising, we have to limit viral spread to new hosts, effectively limiting how often the virus replicates. The vaccines that we have appear to do that very well by making recipients a lot less likely to catch the disease, which is why the choice to be vaccinated is not just a personal one, but a social one as well. Even if you say yes to vaccines, you could potentially become infected, but the chances are much greater if you say no, which you might consider to be your choice and your right, but it unfortunately doesn't stop there. That choice not only poses a potential danger to other unvaccinated people around you, which is bad enough, it also potentially offers the virus more opportunities to mutate into something possibly even worse for all of us, like a variant that's resistant to current versions of our most powerful defense against it, vaccines.